I'm going to talk about why I think dental extractions are horrible for human beings. A lot of people have asked me, are dental extractions bad? Let me answer by saying that I think that they're almost barbaric. Someone put a comment on my post recently that said, extractions are the modern day lobotomy. And I would agree. I think when you understand what happens after you extract teeth that do not need to be extracted, you'll understand what I mean. And I say need to be extracted because sometimes like a tooth is, completely rotten and you need to take it out and there's nothing you can do. Like the problem is already too late. Let me start by talking a little story. I used to spend a lot of time on Facebook groups, TMJ Facebook groups. I was probably on like 7 or 8 different big groups in 2015, 16, 17, 18. And then I started to tail off and, from about 19, I didn't really visit them anymore. But there were 4 years or so where I was checking, the posts every day on my Facebook feed and seeing the stories. One thing that I would see a lot is when there would be people that did some kind of dental extraction, right? And then they're talking about all the pain and suffering that they're going through, or how their face changed, or how they're having mental health issues like anxiety or depression. And I would see this constantly. Like, there was a point where I feel like I'd see one or several stories in my Facebook feed every day, and it just got like second nature that these things are related because you see it so often in people's stories. And so there was this one girl, I remember, I think I had commented on her post. She'd written a post talking about her story on one of the TMJ groups, and I responded. We ended up messaging each other through Facebook, and she started telling me how she didn't want to do it, and kind of her mother pressured her to do it in some way, and her face changed a lot, and she really hates the way she looks now, and she feels like she's got anxiety and she doesn't like going out. Like, she's telling me all this stuff, right? And I'm just like, I'm kind of trying to be nice. And she starts sending me these photos of what she looked like before, and then she sends me photos of what she looks like now, and like it's a big difference, right? Like you could tell like almost all the dimension was taken out of her face, and she just looks like she like aged a lot. And she was still, a young girl. Like I think she was in her early 20s. I felt bad, but there was nothing I could really do. I just kind of made a polite like I gotta go, and I never saw or heard from her again after that. I don't know what happened. But I would say that her story is very typical of stories that you would see all the time. So why do dentists extract teeth? Well, dentists extract teeth for a variety of reasons. So some of them need to happen. Tooth is rotten, there's infection, maybe there's trauma. But the one that is usually the most damaging that I see is when they do it for orthodontic reasons. So when they extract teeth to make space, right? So that the other teeth can be straight. And there's one treatment in particular that has ended up doing a lot of damage. And many dentists were doing it at one point. I think a lot less dentists do now, but it's basically bicuspid extractions. You're taking out 4 big teeth at the same time. And then often afterwards, you're using braces or something to put the rest of them in line, right? And the number of stories I've seen from this specific treatment of people that have just been, devastated from it in the years following, it's just been massive. Like I've literally never heard of a person that did this and came out okay, which you got to wonder, like, what is the dental profession paying attention to if like they're not seeing this, because it's literally every single case. What you see when people do this is they might be okay for a little while after, for like a couple weeks or months. And usually that's when the dentists take their photos and, they show their before and after, and the kid still looks okay. But then if you followed that kid for another like few years or even 5 years after, you'd see like probably a broken person. Person would look very different. Their personality would have probably changed. They would probably often have a mental health issue at that point. That is just how damaging this stuff is. You can look at a lot of before and afters of people that have done this, and you just see like their face completely changes, their profile disappears, and their bodies change a lot. And this is what I call this collapse, right? This is a classic example of what I call biomechanical collapse. Why don't dentists know this stuff? Well, they haven't been taught it. Right? Nobody taught that you can't do this stuff. Like, but rather, like dental schools were actually teaching that you can do bicuspid extractions. That is why it is very difficult to sue a dentist for this stuff, because his response to the court is going to be, I just did what I was taught in dental school, right? So to change the system, you need to change what they're being taught in dental school because it's just wrong. I think a lot of the various types of orthodontic extractions that they do should just be outright illegal, right? Like you're taking a sledgehammer to the person's structure, right? It's like being able to go to the hospital and get a service where someone stabs you 5 times in the chest. Like that will never exist as a medical service, and extractions are probably even more damaging long term than getting stabbed 5 times in the chest. Yet, because of this, like patients really don't have any chance of you don't see it in the courts, right? So dentists do it because they're not afraid of getting sued, and it's a pretty lucrative treatment. It's a good way of making money, and often they probably find that after patients do this, like they need a lot more dental treatment. So it's kind of like in their interest to screw the people up by doing this. And one good example is my friend Tunin that I wrote about a little while ago. He was living in the UK and he had, I think, the 4 bicuspid extractions, completely ruined his structure. He didn't really put it together that that was the cause. I opened him up to the idea right on, the end of his life, but then he ended up dying. And like he died at a pretty, I think in his early 50s. And I would say that treatment killed him. Like it created the foundation that eventually killed him. And people think like you have to do these extractions. Like you need to have straight teeth. It's functionally correct. And I think it's completely wrong. Like you can just wear a rubber mouth guard. It takes longer, but eventually you'll make more space and the teeth will come into a line. And I think, there is no reason why things like bicuspid extraction should be done these days. Like there is no health need for it. So some final thoughts. I think that, while this practice is waning away, it's still being done. I still see people being damaged by it. And I think that history is going to consider it barbaric. And I think that, we need to push the dental institutions to change. Like if there's one thing I've taken away from the last 10 years is that the dental institution, if you just leave it up to its own, like it's not going to do anything progressive really. And you need to almost mock it into change, right? And that's why I love that today we've got TikTok, we've got X, we've got Substack. That is where we do our battle to get this kind of change, right? We make fun of this practice and the dentists that still do it. We try to make them look stupid, right? We even try to make them look evil for doing this, because when you see what happens to these people years on, right? Like it's just horrible. The people that are doing this need to recognize the damage that they're doing.